closed with a 7/0 nylon. Let me focus on something that I've devised. This is going to be helpful for people that do Asian eyelids and even those that don't, just to stay out of trouble. So I have divided the aging Asian eyelid into without a crease, with a crease, and with a man-made crease in the past. So how do we address this? We first look at without the crease. The natural temptation is just take some skin out. The real problem with this is because the post-septal fat is so low, you're going to still have a very narrow palpebral fissure. The patient may say, I don't see much change. And that's a problem. If you go back and say, I'll just take some fat out. I've seen the problem with that is if you go in the post-septal fat, you take it out without creating a fixation, you can have inconsistent fixation that you didn't even attend. And that's a problem. And so I really caution you to be careful with this. I'm going to give you some strategies of how to do this in a moment, but I use a lot of fat grafting to take care of this, or I counsel them about putting a crease in, but there's going to be recovery involved, and there's also going to change the look, and that may be something unacceptable to someone older, and that's important to understand. Plus, when I'm doing aging Asian eyelid, I like to do it under just light sedation, and it sort of is harder when I'm doing deeper sedation work. So I'll do that first, and then go ahead and then do the rest of my other work, with facelifts and fat grafting and that nature. If you look at a natural crease, you go, oh, this is easy. You know, this is easy, Sam. I can go ahead and just take some skin out. Well, that's true, but you remember the cultural element, as Dr. Anna was alluding to, is you got to be careful in making that crease too high. If you make it high, it can look okay in a Caucasian. My aesthetic is it also looks bad on a Caucasian because I do a lot of fat grafting, but it definitely looks terrible on an Asian. So be very careful in just taking skin out or combining that with a brow lift because things don't look so good or potentially can look bad. How do I do it? Very conservative skin removal, and I almost always have fat to maintain eyelid position. Again, that won't make sense until I show you some before and afters. And then finally, understand this is that the term westernization, I sort of subcategorize that and look at that as a time when it was highly cut and a lot of fat taken out back in the 1980s. And the thing that I'll tell you that sometimes you look at these patients, you go, oh, the crease is really low, and you know they had this in the 1980s, but it looks weird. What is it about it? And what it is that brow thick skin has actually become ptotic and deflated, and it's hanging over, so there's a little tiny crease, but it looks completely unnatural, and you can't figure out why. All you've got to do is take a finger, lift it up, and you go, oh my God, she's got a crease that high, it just fell over. So be very careful in just taking skin out of that person because you can actually unmask a prior result that looks bad. This is a lady where, again, it looks like an eye bag, it looks like a dermatochalasis, and all I just did was add fat around the eyes, cheeks, and jawline, and that helps balance it. There was no cutting. This is a lady where you can see she's got some of that orbital hollowness, and there's a double fold at that point. I did take a little bit of skin from the upper eyelids, but I went ahead and contoured it. So I challenge you to think not just about incisional heights, but also contour, because there are two elements of the aging process that we may not all the time look at. Complications, Dr. John's done a wonderful job. I'm not going to go through that. This is a partial incision technique. I want you to compare the recoveries of both. I don't do the partial, but this is 1 week out and then about 3 months out after just that small abbreviated partial incision, which I no longer do. My full incision work, this is a week out, and then this is about 7 months out. I do have a year, and I have not updated it. I apologize for that. The year is on my website. And this is a year out after the full incision technique. Again, no fat removal, just fixation of the crease. So I really just challenge you to be thoughtful about preserving ethnicity and be mindful about some of the pearls and pitfalls that I expressed today. I'm going to plug my book here, but there's a book that's also been translated Korean if you want to know more about how I think about fat contour being a component of the aging process, both for Caucasians and Asians. That's my other book. So I thank you for your attention. If you want to email me, ask me any questions, that's my email there. Thank you very much.